Hello and welcome to Fit Professionals. My name is Michael Coleman. This video is part one of a two-part series. One of the first things I learned when studying to become a corrective exercise specialist and personal trainer was the importance of having a very strong referral network. Of course, no one knows everything. That's why it's part of my duty to refer my clients to other therapies and other doctors who can help them in areas outside of my scope of practice. Hi. In just a few minutes, I had the privilege of interviewing someone I respect very much. In her practice, she keeps very busy taking care of her patients. And at home, she always creates quality time for her children and her husband. Still, with persistence, I was able to steal a few minutes out of her busy day to share some stories with you, along with some technical stuff, explaining the amazing therapeutic approach that she uses. Dr. Sally Korb is an experienced doctor of physical therapy, specializing in chronic pain management. After earning her doctorate in physical therapy from Carroll University in 2007, she pursued formal training in fascial Counterstrain beginning in 2012. Dr. Korb has experience working in sports medicine, acute hospital settings, home health, and privately owned clinics. Later, during the interview, Dr. Korb will go into detail about what she does. But for now, I'd like to quickly quote the basics from her website. Fascial Counterstrain therapy is a hands-on approach to addressing dysfunctional fascia, the connective tissue that surrounds and interconnects all structures within the body, including muscles, nerves, blood vessels, and organs. By restoring balance to the fascial system, Fascial Counterstrain seeks to enhance overall mobility, reduce pain, and support the body's natural healing process. Hi, Dr. Sally Korb.
Hi.
I've known you for over 4 years, so I'm just going to call you Sally if you don't mind.
Yeah, thank you for inviting me.
Okay, well, thank you for coming. I know you're super busy. And so can you tell everyone that's listening what you do?
Well, I'm a physical therapist by training, but of course I found Counterstrain, and now that's all I do because it works. So I treat the fascial tissue. It wraps around every structure in the body, arteries, veins, nerves, bone, everything, viscera, and it runs up, attaches to the head, so I feel the head. And that to me is a map. It's a map for the body. It tells me where the dysfunction is in the body. And then rather than other myofascial releases out there, this myofascial release is different because I find a tender point, I find a point of dysfunction, shorten the tissue, it resets it, goes into the proper direction, and relaxes for a longer effect.
Okay, can you help kind of walk me through the difference between pushing through something or allowing? I've been researching a little bit and talking about putting someone in a comfortable position as opposed to uncomfortable position, range of motion. So can you kind of explain the difference between the two approaches? Because I know that some physical therapists use a more, I don't want to call it aggressive, but a different approach.
And I definitely had to change my way of thinking. So first, let me give you a visual image because this helped me when I was trying to understand it.
Sure.
So if you imagine a rope with a knot in the middle, and you pull both ends of that rope, and you stretch it, right, which is what we were taught, to stretch it, well, that knot gets tighter, okay?
Oh, okay.
So if you bring both hands on the end of that rope and approximate those ends, then that knot gets looser. So that's the idea you can have in your head when you think about shortening structures, shortening tissue in the body. So I'll find a tender point.
Sure.
And so then I know what structure attaches there, that fascia attaches there, shorten that structure, and it releases that fascia with a great neuromuscular result, with longer results for the patient too.
That sounds really interesting. Now, how does that, can you give me an example of a story of someone who has maybe had some other kinds of treatment and come to Counterstrain, and that might help it make it easier for everybody to kind of understand what it is?
Yeah, absolutely. I have many.
Oh, but you can.
I will pick
No
for
problem.
one for now, just because this is a common one.
Sure.
Had a man come in with severe neck pain. He was a hard worker his whole life. Pain down his arm, tingling, numbness, the whole deal. Looking at surgery, tried all the things. He came to me from like a workman's comp location, tried everything, and without success, surgery was the next thing on the docket for him.
Okay.
Well, I worked in his neck, released some fascia around some of the arteries and nerves and veins in there. Now his body could function better. Those arteries and nerves and veins could work better. I could feel the muscles relax under my hand while I was working.
So immediate, like within 90 seconds or so, you're talking?
Yeah, 90 seconds for the release, sure. And then by the end of the session, he can move his arm all the way up above his head.
Okay.
He was fairly pain-free. I mean, I think it maybe took 3 sessions. And yeah, I mean, now he's doing really great now.
The these ligaments are a little tight here, so here, let me unhinge this one.
Okay.
So can you give me an idea of where, like, shoulders are impinged or where there's difficulty?
Absolutely. Okay, so a lot of you hear about the rotator cuff muscle, that pops up all the time. People are worried about a rotator cuff tear. So the most common thing we find is a muscle that sits in here, the supraspinatus, okay? And that tendon from that muscle comes in and wraps around the front here. Okay? So you see that's not a big space there.
Yeah, it's really tiny.
Really small. Now you sit forward and you have a tech neck, right? You sit forward at a screen all day.
Sure.
This little spot here is going to get real tight, inflamed, and swollen. And every time you try to raise your arm, that tendon is going to get inflamed.
Okay.
And rub against everything here.
Okay.
So my job is to take the inflammation out of there, help that body restore the tendon to its proper function, and bring that posture back. Because now when you don't have pulling, you can have proper posture.
So, so you're talking about the ligaments. Now, would you find there something with nerves in there too? I mean, what innervates this area? Give me an idea of...
So there's a lot of nerves in here.
Okay.
So the fascia can get tight around the nerves, and there's fascia that attaches along here, along here, along here. There's a couple nerves in here. There's a lot.
Okay.
So if fascia
I've heard it called the viper's nest.
There's so many points in this area. That's why you got to give me a few sessions. There's so much happening here.
Okay.
There's like 1,600 points in the whole body. So.
Okay.
Anyways, so if fascia gets tight around that nerve, let's say you can imagine that nerve, it's going to pinch that nerve a little bit, but then it's going to pull on this head of the humerus and bring it forward. It's going to pull on this clavicle and bring it forward, and again cause more inflammation in there.
I see.
So it gets real tight. I would loosen that up, and you can watch people stand up. I've had 3 people last week that walked out of my office, and their loved one was waiting for them in the lobby, and they said, "Oh, you look taller."
Wow! Wow!
Because the fascia released, and then they could actually move.
One session.
That's one session.
Wow!
Absolutely, yeah. Wow. You can see that change in one session.
We're talking about dura. I originally started with craniosacral therapy, and that was the first time that I personally got to understand the anatomy of the head, and especially when you see one cut in half, it's serious, and looking at all of the different structures, and also this idea that you had this tube that goes down, and it was really interesting to me. So is dura part of the fascial network? And I know you have a story that you want to tell about that, so
sure,
that's my segue.
Yeah, that's a great segue.
Okay.
Well, is dura part of it? Yes, actually, as embryos, when we're forming, the dura mater gives way to all the fascia in the body.
So it's a source of it.
It's a source.
Okay.
So that's why there's such a strong cranial scan connected to the rest of the body.
I see.
So when you have a brain injury, head injury, concussion. So I always say I accidentally fix things. I never make promises. I can help pain. That's what I can say. I help pain.
This is a disclaimer. I heard this story and it's amazing. So she's disclaiming it doesn't always work for everybody, so it's important. Okay.
So you're going to come in with strange things. That's great. I might fix it. So for example, I had a young man who in his teen years, he did a lot of BMX riding and concussions, lost vision centrally in one of his eyes. That was when he was young. Lots of pain everywhere. Migraines, of course, now in his 30s, trying to deal with migraines.
Wow.
They're not good. Trying to raise a family. So I treated the dura, kind of released that head. That was great. And then I worked on the artery to his eye. So that artery is healthy. It's great. I'm not working on the artery itself, just the fascia that surrounds it. And I released the fascia around the artery to his eye, and immediately his vision came back.
Wow.
He jumped up off the table.
Wow.
I think I was just as surprised
I would
as
jump
him.
up. Oh my gosh. Oh my gosh.
But
I mean, that's amazing. When you first told me that story too, I've worked with blind people before, through, what I do. So it really touched me to hear that story and to think that, there are things that are hidden within us, and if they can accidentally be fixed, I think that's amazing. But just understanding how everything's interconnected is amazing. So can you tell me some of the problem areas that you see with the neck specifically? Okay.
Oh, I'd love to. So a lot of times you get this forward head position. You know, you're sitting at your desk and kind of forward head. Sometimes you lose this arch. Another big one is car accidents, and that C1, C2 just gets very, very disabled, dysfunctional. Dysfunctional. That's the word. And another thing that I want to mention with the neck as well, and I want to say this too, is that pain lies. So sometimes you might be feeling pain in your hand, but it's coming from the neck, right?
Sure.
Not necessarily the nerve. There's ligaments, that the ligamentum flavum that sits next to the spine in the neck.
Sure.
Release that, and you'll get changes in the different joints down the way. In the hand, the elbow, it'll change. So. Okay. Yeah.
So you're saying that some of the hand or arm problems can be coming from the neck too?
Absolutely.
Okay.
Yep.
Okay. So what would be one of the most common neck issues that you deal with?
In my world, lately, it's been car accidents. And even car accidents 20 years ago. You think, oh, that was 20 years ago. My neck is fine after that. Not necessarily. That injury sits in there. That's a memory deep in that neck that will cause problems in the future, even 20 years down the road.
Wow.
So you get this neck moving, it'll actually help open up some of the veins here. This is a big one, is veins in this upper neck, post-car accident, whiplash, whatever. You'll be able to drain the veins. Remember, the veins drain. They bring blood back to the heart. So if you've got inflammation and stasis up in that brain and head, now you're talking about headaches and fullness of the head.
How long in stasis are you talking about here?
Could be 20 years, decades.
Wow.
Okay, you think about someone that gets frequent headaches or even disease.
Sure.
Lyme's disease.
Sure.
Lyme disease coupled with car accidents.
Wow.
Absolutely.
That's big in this state for sure.
Yeah, absolutely.
Wow. Just real quick, when you get into the thoracic spine, and especially between C7 and T1,
yes.
Can you give me a little bit of something about the thoracic spine?
Yeah. So a big thing, everyone is different, of course, but a big thing I see is C7, T1, T2 is sympathetic nervous system, fight or flight. That stress, anxiety, again, we're talking about the body holds a memory, right? There's a book about that.
Sure.
Body holds that inflammation over years. You have a stressful trauma event happen.
Sure.
And that fires up that sympathetic nervous system. Now you feel like that anxiety, stress, it hits your body, your physical body. People that have that know what I'm talking about.
Yeah.
So there's a lot of points in here for those nerves to calm, and I see it. You can see the person calm down on the table, and there's lasting effects. I've been able to bring 3 or 4 people back to work. They couldn't work because they were in such severe anxiety.
Yeah, okay.
And I was able, but another big thing with the thoracic spine is the sternum. You release that sternum, and then that's when you get the people standing up straight.
Okay.
Yep.
Wow. So, and obviously that is a big factor in mobility too. I mean, one of the things that I'm working on right now is people who come to me who need something like your therapy before getting into a gym or before really stretching, and some of their problems they think are muscular, but there may be some deeper causes for sure.
Sure. Well, the muscle is there. That's a sign for me. I don't talk a lot about muscles, even as a physical therapist. The reason why is because those muscles are guarding for a reason. They're guarding something. So finding immobility, that's my diagnostics when I start. Finding something that's immobile, finding dysfunction, finding a tight muscle, that's just a sign pointing me where to go. That muscle is protecting, let's pretend there's fascia that's tight around an artery. Now the doctor they won't find anything wrong with your artery. They'll take a scan. That's not the problem. The problem is the artery, it's the fascia. So I'll release that fascia around the artery, not treating the artery itself, just the fascia, and then we'll feel that muscle just relax.
With mobility, I've heard that the foot is very important and that many of the lines of fascia and I guess insertion points, maybe, there's just so many different muscles there. So I'd like to talk about the foot, and I happen to have a foot here.
Amazing.
Well, it's not a real foot, but we have some ligaments and some fake bones that we can play with.
So, a big one that I see in feet, of course, is plantar fasciitis.
Okay.
So I'll tell a story about a guy that I see let's see, he might be in his 50s, 60s, athletic, plays on all his baseball team, softball, and wants to continue on, and thinks, well, I'm getting old, my feet are starting to hurt, and he just kind of, well, I guess I have to stop. And then he found out about me. He was having severe plantar fasciitis. I mean, look at this long fascia that runs, it runs all the way to the heel, okay? And it gets tight and it hurts to stand up in the morning. That's the worst. But
I've seen people wear those socks where they sleep, where their foot, just because they get so tight that they sleep and have these socks that pull in there. Wow. Okay.
Absolutely.
It's not a fun. I'm sure it's not a fun condition.
And that's what I was taught in PT school. Like keep stretching and pulling and mashing on it, right?
Yeah.
And it just comes right back. That was his problem.
Yeah.
Well, there's some ligaments in here that attach up into the spine, lumbar sacrum spine. Spine.
Okay. Can you walk me through exactly how those ligaments in the foot are connect to the spine?
Sorry, I should say it's the fascia. The fascia wraps around down here in these ligaments.
Okay.
Runs all the way up to the spine. So, and I would treat his spine, and we could feel his foot soften and loosen up.
So there are points in the lumbar spine, and so he thinks it's here.
Oh, sure, he points here every time.
But it's actually, the source is way up here. Right there. Yeah.
Yep. In fact, I had a lady that I couldn't get her foot to loosen up. And then I remembered there's points in the eyeball that can connect into the foot. So I moved her eyeball and I restored this ankle motion right away.
Wow. Yeah.
Here's one.
Everything is connected.
Everything's connected.
Learn how to train pain-free. Get the most effective pro tips delivered to your inbox each week by subscribing today to our free newsletter at fitprofessionals.beehiiv.com.